Cell therapies have really developed as a very exciting new area in hematology, and these therapies, in particular the CAR T-cell therapy, has made an enormous development during the last years, and all of them offer a really great potential for curative treatment in patients with hematologic diseases.
A CAR T therapy is the only targeted cellular therapy, and we have learned in the example of the diffuse large cell lymphoma that CAR T cell therapy might have the potential also to replace the cellular therapy like the allogeneic transplant or even the autologous transplant.
Our department is one of the largest of its kind in Germany. We have a long tradition in allogeneic transplantation. The first allotransplant actually was performed in 1972, and our center was founding member of the EBMT. We have very strong clinical and translational research programs, in particular in acute myeloid leukemia and chronic lymphocytic leukemia, but also in cellular therapies. One asset that sets us apart, our department hosts the Central Clinical Trials Office and also the Central Genetic Laboratory of the German-Austrian AML study group, the AMLSG.
We perform circa 250 cell therapies per year with this portfolio.
The essential steps in the diagnosis of acute myeloid leukemia are morphology of the blood and the bone marrow smears, then multi-parameter flow cytometry to correctly assign the lineage of the leukemia. And then we have conventional cytogenetics, that means karyotyping. This is still the gold standard in the diagnosis of acute myeloid leukemia. And very, very important, molecular profiling of genes according to the European Leukemia Net recommendations that have been updated in 2022. AML is characterized by the presence of so-called molecular markers, and these are mainly gene mutations, gene alterations. And for some of these molecular markers, it has been shown that they are prognostically relevant, and some of them are also predictive for a specific therapy. So the main techniques that we are using in our molecular diagnostic lab are mainly based on the classical modern molecular genetic methods, but I think the core piece of our laboratory is that we are providing molecular profiling of 15 AML-associated genetic molecular markers in a very short turnaround time in 48 hours, and this is taking place for 7 days a week.
A patient with a high-risk acute myeloid leukemia who has an indication for allogeneic stem cell transplantation has his first contact with our team in the outpatient setting. There we explain the patient the basic principles of allogeneic stem cell transplantation, the steps he needs to go through during the whole procedure, and also the potential life-threatening complications. After that, the patient comes to our inpatient ward, and then we start with a preparative conditioning regimen based on chemo and or radiotherapy. At the end of that, we infuse hematopoietic stem cells, and then the patient undergoes 10 to 14 days aplasia. After that, we see engraftment if no major complications occur after day 14. And then if everything goes well, the patient could be discharged on day 20 to 30 after transplantation.
The outpatient clinic of the University of Ulm. We are here to guide patients after stem cell transplantation, and we have a comprehensive approach which is vital for the patients to improve after allogeneic stem cell transplantation. And we manage up to 600 patients a year, which are about more than 5,000 cases. And our approach is to have a really close contact with the patients so they can decide themselves which path is the next way to go.
For me as a nurse, it's all about communication, because sometimes patients tell me different things than they tell the doctors, for example. So we need to communicate with each other to get a bigger picture of our patients, and that everyone has the same information and we can take the best possible care. Caring for patients after an allogeneic stem cell transplantation is just teamwork.
The vision for the future is try to integrate as much as possible the gold standard treatment that we have nowadays together with a continuous tension to innovation. And we will reach this goal with the help of clinical studies, ranging from the diagnosis to induction chemotherapy, but also we will try to face the important themes of life-threatening complications after allogeneic stem cell transplantation like GVHD, but also to a theme of disease reoccurrence after transplantation, which is also one of the most important cause death after transplant, with studies focusing, for example, on maintenance treatment, and of course a strong focus on CAR T-cell treatment is very important in order to rescue patients with high-risk disease who are refractory or resistant to standard treatment.
What excites us the most is doing research at the cutting edge with all the new agents and treatment options coming up. It is doing research within our international network, and it's the fact being able to offer our patients a very high degree of innovation. And we are confident that our department will continue to make major contributions to improving outcome of AML patients.